Sinus tachycardia, Heart&Techy. Hi friends, today in this video we are going to discuss about sinus tachycardia. What is meant by tachycardia? Tachy means increasing heart rate more than 100 beats per minute. Before going to discuss about this topic, we have to know what is meant by sinus rhythm. You can refer this topic in my previous video, link is given in the description box. In sinus tachy there is no any conduction-related abnormality present, only the PQRS and T complex is recorded in rapid succession. Sinus tachy is a normal physiological response during emotion, respiration, exercise. But some cases sinus tachycardia also occur in some pathological conditions such as thyrotoxicosis, toxemia, cardiac failure. In cardiac failure this arrhythmia mainly occur as a result of increased Bainbridge reflex. It is a normal accompaniment in fever. The sinus rate will increase by 8 beats per minute for every 1 degree increase in temperature. What is meant by chronotropic incompetence? It is an inability to increase the heart rate according to our physiological need. For example, some people they don't have an increase in heart rate during exercise to meet their body physiological need. Inappropriate sinus tachy is a clinical situation where sinus tachy is present without any identifiable causes. These are caused by either inappropriate increase of sinus node automaticity. This is an example of sinus tachycardia. Carotid sinus massage or compression will help us to terminate this kind of arrhythmia. If you like my channel, please do like, share and subscribe. Any comments or queries, do comment in the comment box. Stay tuned with Heart&Techy. Thank you.